Mental health disorders are a growing concern worldwide. The World Health Organization estimates that 1 in 4 people will be affected by mental or neurological disorders at some point in their lives. This staggering statistic highlights the urgent need for effective and accessible mental health care solutions. Traditional therapy, while effective, doesn't always resonate with everyone. Some individuals may find it difficult to open up in a face-to-face setting, while others may struggle with the stigma associated with seeking help. Enter virtual reality, or VR, a cutting-edge technology that is revolutionizing the way we approach mental health treatment. VR has the potential to break down these barriers by offering a more engaging and less intimidating alternative to traditional therapy. VR offers immersive and interactive experiences that can transport patients to different environments and scenarios, all from the comfort of a therapist's office. This can be particularly beneficial for individuals who have difficulty visualizing or imagining scenarios during traditional therapy sessions. This innovative approach is opening up new possibilities for addressing a wide range of mental health conditions, from anxiety and phobias to PTSD and depression. By simulating real-life situations, VR therapy can help patients confront and manage their fears in a controlled and safe environment. The use of VR in mental health therapy is rapidly gaining traction. More and more clinicians are incorporating VR into their practice, recognizing its potential to enhance the therapeutic process and provide more personalized treatment options. Clinicians and researchers are excited about its potential to enhance traditional therapy methods and improve patient outcomes. Studies have shown that VR therapy can be just as effective, if not more so, than traditional therapy for certain conditions. VR therapy is not meant to replace traditional therapy, but rather to complement and enhance it. By integrating VR into existing treatment plans, therapists can offer a more comprehensive and multifaceted approach to mental health care. By providing a safe and controlled environment, VR allows patients to confront their fears, practice coping mechanisms, and develop essential life skills in a way that feels real, but without the risks associated with real-world exposure. This can lead to greater confidence and improved outcomes in their daily lives. The increasing availability of affordable VR headsets and software is making this technology more accessible to mental health practitioners. This democratization of VR technology means that more patients can benefit from its therapeutic potential. This is particularly significant in light of the growing demand for mental health services and the shortage of qualified therapists. VR therapy can help bridge this gap by providing an alternative avenue for treatment, potentially reducing wait times and increasing access to care. VR therapy has the potential to bridge this gap by providing an alternative avenue for treatment. It can be especially useful in remote or underserved areas where access to mental health professionals is limited. As the field of VR therapy continues to evolve, we can expect to see even more innovative applications and wider adoption in the years to come. Researchers are constantly exploring new ways to utilize VR technology to address a broader range of mental health issues. The potential of VR in mental health care is vast. From treating specific phobias to providing general stress relief, the applications are nearly limitless. As technology advances, so too will the capabilities of VR therapy. This technology is still in its early stages of development, but the initial results are promising. Early studies have shown significant improvements in patients' symptoms and overall well-being. As researchers continue to explore the capabilities of VR, we can anticipate even more sophisticated and effective applications for treating a broader range of mental health conditions. The future of mental health care is looking brighter with the integration of VR technology. VR therapy represents a paradigm shift in mental health care, offering new hope and possibilities for individuals struggling with mental health challenges. With continued research and development, VR has the potential to transform the way we understand and treat mental health. Virtual reality therapy, or VR therapy, leverages the power of immersive technology to create realistic simulations of real-life situations. This innovative approach is transforming the landscape of mental health treatment by providing a unique and engaging way for patients to confront and manage their issues. Patients wear a VR headset that displays a three-dimensional environment, allowing them to interact with the virtual world as if they were physically present. This immersive experience can make the therapy sessions more engaging and effective as patients feel more involved in the process. This technology is particularly effective for treating anxiety disorders, phobias, and PTSD. as it allows patients to gradually confront their fears in a safe and controlled environment. By simulating real-life scenarios, VR therapy helps patients build resilience and coping mechanisms. For instance, someone with a fear of flying might use VR therapy to experience a simulated flight. This can be a game changer for individuals who have avoided air travel due to their phobia. They can put on the VR headset and find themselves seated on an airplane. The virtual environment is designed to be as realistic as possible, providing a safe space for the patient to confront their fear. The simulation can mimic the sights, sounds, and even the feeling of takeoff and landing. This level of detail helps to create a truly immersive experience that can significantly reduce anxiety over time. This immersive experience can help desensitize the patient to the triggers associated with flying, reducing their anxiety over time. By repeatedly experiencing these triggers in a controlled setting, patients can gradually build up their tolerance and reduce their fear. Another example is the use of VR therapy for treating social anxiety disorder. This condition can be debilitating, making it difficult for individuals to engage in social interactions. Patients can engage in simulated social interactions, such as public speaking or attending a party, within the virtual environment. These scenarios are designed to mimic real-life situations, providing a safe space for patients to practice and improve their social skills. They can practice their social skills and build confidence in a safe space, without the fear of judgment or negative consequences that they might experience in real-life situations. This can be particularly beneficial for individuals who struggle with severe social anxiety. The therapist can observe their progress and provide feedback and guidance in real time. This allows for a more dynamic and responsive therapy session, where adjustments can be made on the fly to better suit the patient's needs. VR therapy can be tailored to individual needs and can be used to address a wide range of scenarios. This customization ensures that each patient receives the most effective treatment possible based on their specific fears and anxieties. Whether it's a fear of heights, spiders, or public speaking, VR can create realistic simulations that allow patients to confront their fears head-on. This direct confrontation is a key component of exposure therapy, which is a well-established method for treating phobias. The immersive nature of VR makes the experience feel real, enhancing the effectiveness of the therapy. Patients are more likely to engage with the treatment and make meaningful progress when they feel fully immersed in the virtual environment. As patients progress through the therapy, the therapist can adjust the difficulty level of the simulations to ensure they are continually challenged and making progress. This adaptability is one of the key strengths of VR therapy, allowing for a personalized and evolving treatment plan that can lead to lasting improvements in mental health. While VR technology provides the tools for immersive therapy, it is the therapist who guides the patient's journey to recovery. The therapist plays a crucial role in assessing the patient's needs, developing a personalized treatment plan, and monitoring their progress throughout the therapy sessions. They provide support, encouragement, and guidance, ensuring the patient feels safe and comfortable during their virtual experiences. Before starting VR therapy, the therapist will conduct a thorough assessment of the patient's condition and medical history. This is essential to determine the suitability of VR therapy for the individual and to identify any potential risks or contraindications. Based on this assessment, the therapist will work with the patient to develop a tailored treatment plan that outlines the specific goals, techniques, and duration of the therapy. During the VR therapy sessions, the therapist will closely monitor the patient's reactions and adjust the virtual environment as needed. They may change the intensity of the simulation, introduce new challenges, or provide relaxation techniques to help the patient manage any anxiety or discomfort they may experience. The therapist's role is to ensure the patient feels supported and empowered throughout the process. After each VR therapy session, the therapist will debrief with the patient, discussing their experience, progress, and any insights gained. They will work together to process the emotions and thoughts that surfaced during the session and develop coping mechanisms to manage similar situations in real life. The therapist will also provide homework assignments to reinforce the skills learned during the therapy sessions and encourage the patient to apply them in their daily lives. One of the most promising applications of VR therapy is in the treatment of anxiety disorders. This innovative approach is revolutionizing the way mental health professionals address these conditions. Anxiety disorders are the most common mental illness in the United States, affecting millions of adults. These disorders can significantly impact daily life, making it difficult for individuals to function normally. VR therapy offers a new avenue for treating these conditions by providing a safe and controlled environment for exposure therapy. This method allows patients to confront their fears in a virtual setting, which can be less intimidating than real-life situations. Exposure therapy involves gradually exposing patients to the objects or situations they fear, helping them to reduce their anxiety over time. This gradual exposure is crucial in helping patients build resilience and confidence. For example, someone with social anxiety disorder might use VR therapy to practice public speaking. This can be particularly beneficial for individuals who find it challenging to practice in front of real audiences. They can put on the VR headset and find themselves standing on a virtual stage, facing an audience. The realism of the simulation helps to evoke genuine feelings of anxiety, making the practice more effective. The simulation can mimic the feeling of being watched and judged, allowing the patient to practice their speech and develop coping mechanisms for managing their anxiety in a safe and controlled setting. Over time, this practice can lead to significant improvements in their ability to handle real-life public speaking situations. VR therapy can also be used to treat specific phobias, such as the fear of spiders, heights, or enclosed spaces. These phobias can be debilitating, but VR therapy offers a way to confront them without the immediate risks associated with real-life exposure. By creating realistic simulations of these feared objects or situations, VR therapy allows patients to confront their phobias in a controlled and gradual manner. This controlled exposure helps to desensitize patients to their fears, reducing the intensity of their phobic reactions over time. The therapist can adjust the intensity of the simulation based on the patient's progress, ensuring they are challenged but not overwhelmed. This customization is key to the therapy's effectiveness, as it allows for a tailored approach to each individual's needs. Another area where VR therapy shows promise is in the treatment of panic disorder. This condition can be particularly challenging to manage, but VR therapy offers new hope for those affected. Panic disorder is characterized by recurrent panic attacks, which are sudden episodes of intense fear that can be debilitating. These attacks can occur without warning, making it difficult for individuals to feel safe in their daily lives. VR therapy can be used to simulate the physical sensations associated with panic attacks, such as a racing heart, dizziness, or shortness of breath. By experiencing these sensations in a controlled environment, patients can learn to manage their reactions more effectively. By exposing patients to these sensations in a controlled environment, VR therapy can help them to learn that these sensations are not dangerous and to develop coping mechanisms for managing them. This can lead to a significant reduction in the frequency and severity of panic attacks, improving the overall quality of life for those affected.